Once the governor starts speaking, really at any minute now, we will bring you his comments right here on 12 News. Well, Arizona continues to see a spike in COVID-19 cases, as we just mentioned. This week, we've seen more than 3,000 new confirmed cases and new cases popping up in Valley schools. Team 12's Trisha Hendricks joins us with the details from Fountain Hills High School that's sending students back to online learning.
Fountain Hills High School will be closed for the next couple weeks due to a COVID-related issue on campus. Now, that's according to a letter sent to parents just yesterday. In that letter, the principal said due to the number of students who have been in direct contact with a person who tested positive, they felt this decision is in the best interest of students. So this means all students must quarantine for the next 14 days, and all extracurricular activities are also being canceled during this time. In a letter sent to parents Tuesday, the district said an unidentified number of students may have been exposed to the virus at an out-of-district event, but that none of the students who attended that event were showing symptoms or had tested positive as of Tuesday. But according to the superintendent, the circumstances changed quickly.
It's just a difficult situation for all of us to navigate. It's new for everyone, and I would appreciate a little bit more proactive approach in getting us the information.
So this morning, all Fountain Hills High School students will resume classes through remote learning from home, with the possibility of returning to campus November 12th. Of course, that's always subject to change if more cases arise. And while some schools are going back to remote learning due to COVID, others are reversing course. Today, J.O. School District is resuming all in-person instruction, and that includes sports and activities for students after that temporary closure due to positive cases. In Fountain Hills, Trisha Hendricks, 12 News.
Trisha, thank you. Hashtag most clicked. Here are the stories piquing everyone's interest right now. First, a reminder to be careful when using ride-sharing services. An Uber driver is facing charges for allegedly kidnapping and sexually assaulting a woman in Scottsdale last Friday. After the woman got in the car, court documents say her friends tracked that Uber driver down, saying that they had a bad feeling about him. Mark Taylor is now accused of raping the woman who had come from a house party and was noticeably drunk. The victim says she has no memory of the incident. The state is requesting $250,000 bond, stating that Taylor is a danger to the public. Overseas, 3 people have been killed in a terrorist attack in the French city of Nice at the Notre Dame Basilica. Police say the suspect, who used a knife in the attack, was shot by officers but is alive. France's interior minister chaired a crisis meeting in response to that attack, and President Macron plans to travel to Nice today. Well, listen to this. The government now plans on paying for a coronavirus vaccine once it's ready to make sure everyone can get one if they want one. The Centers for Medicare and Medicaid Services made that announcement yesterday. While the federal government is paying for the vaccine, insurers, including Medicare and Medicaid and private plans, must now cover the cost of getting that shot. Time now to check in with meteorologist Crystal Henderson with a look at these temps that just keep on changing. Crystal?
You can see in this one photograph how our winter weather is yielding to a return of those fall colors and temperatures. We got to get in our snow angels while we still can, because you can see as we roll through the last 24 hours how we have already begun chipping away at the snow that is pasted across our higher terrain, and it will continue to fade away as we reset that thermostat. Just today, we are tacking on an additional 14 degrees to yesterday's high temperatures in the valley. It's going to be an extra 12 degrees with your name on it, Tucson. Temps are going to be jumping up big time in Prescott with an additional 17 digits to your high temperature, and we'll be adding 13 in Show Low. As it plays out through Halloween, each day we are going to be pushing those high temperatures higher. We may add in some clouds at times, but we're keeping it dry and above average as strong high pressure is the boss through the Halloween holiday and the start of November. But we are looking at comfortable temperatures for your little witches and warlocks. So nothing to be afraid of here weather-wise. We will be reading temperatures in the mid to upper 70s in the valley, western Arizona and southern Arizona for trick-or-treating time at 7, 59 degrees in rim country, upper 40s in the White Mountains in northern Arizona with a full moon that night.
Ooh, nice. And I love that candy corn, Crystal. Thank you. Now let's get to a weather alert in the Gulf states. Zeta, now a tropical storm, is responsible for at least 2 deaths since it made landfall yesterday as a strong Cat 2 hurricane. It's caused millions of people to lose power as it marches northeast. In New Orleans, there's a massive effort to clean up and restore power that's only just begun. That storm now making its way to the Atlantic Ocean, moving through Alabama, Georgia, and the mid-Atlantic states, bringing heavy rain and damaging winds.
Tree fell over our porch, dented the fence. The real extent we don't know yet.
Wind gusts were reported up to 110 miles an hour, strong enough to rip roofs off of homes. Well, here's a look at some of the other stories trending today. Developing this noon, if you purchase a ticket to a live event that was canceled or postponed because of COVID-19, well, guess what? You're now eligible for a refund. Attorney General Mark Brnovich struck a deal with Ticketmaster that would refund more than $70 million to music lovers. If you haven't received an email about your refund just yet, well, you want to make sure to file a complaint with the AG's office. Just in time for the weekend's warmer weather. Look at this, I love it. The Oscar Mayer Wienermobile is headed to the Valley for the annual Coast to Coast Weenie Roast. Nice. It started this morning in Gilbert. The iconic car will be cruising around to a collection of fall and Halloween-inspired events through November 7th. I would just love to take a drive in that. This year's cruise would evoke memories of when the Wienermobile was first created. Oscar Mayer's nephew, Carl, pitched it as a way to lift the spirits of Americans during the Great Depression. And now, in this pandemic, well, folks, it may be the extra mustard we all need. I just can't stop looking at that. That's your 12 at 12. The facts on everything you need to know in just 12 minutes, no commercials. We are always on, anywhere, anytime on 12news.com, the 12 News app, and our socials as well. Don't forget, we are still waiting for Governor Ducey's press conference addressing COVID-19. We'll bring it to you any minute now. Have a great day. Good afternoon, everyone. I'm Trea Mai. Here are some of the big stories we're working on right now. In a time where our hospitals are already being pushed to the brink, what we're learning about a massive cyber attack targeting critical U.S. health systems. Plus, with just 5 days until the election, NBC news stations across the country are giving the vote-by-mail system a speed check, what we found over months of testing. Those stories and a whole lot more when you join us for 12 News, First at 4. Breaking news right now on 12 News. I'm Tram Mai. We want to go straight to Governor Ducey, who's holding a press conference right now to address COVID-19. Let's listen in.
And Major General Mick McGuire from the Arizona National Guard. St. Mary's Food Bank is the world's first food bank. Started here in 1967 by John Van Hengel, a man given $3,000 and an empty warehouse to make his dream of providing food to those in need a reality. And boy, have they brought this to life here. Here, with community support, countless Arizonans in need are provided with food. And it's here that the generosity of our citizens to help their fellow neighbor during times of challenges on full display all year long. This year, as the world faces unprecedented challenges during the COVID-19 pandemic, St. Mary's has really risen to the occasion, Tom. We're so grateful for your work and for the work of everyone here, from full-time staff to all the volunteers that you have. We've got an announcement today about how we are partnering with our food banks as we head into the holidays. But I want to start with an update on our biggest challenge we faced this year, COVID-19. Across the country, cases of COVID-19 are increasing, and Arizona is no different. We've been through this before, and we've learned what works to combat this virus. We've had time to prepare. The Department of Health Services is partnering with county public health officials to address local hotspots with the largest spikes. And they are also working closely with schools to prevent and respond to outbreaks in those settings. With enhanced guidelines in place for schools and businesses, and with the leadership of our educators and our business community, I'm confident that we can continue to protect public health and keep our economy moving during this time. I want to turn it over to Dr. Christ for the latest. Doctor?
Thank you, Governor Ducey. So I wanted to provide an update on the trends our public health experts are seeing in Arizona and the steps we're taking to protect Arizonans. We are seeing the spread of COVID-19 moving in the wrong direction, and public health officials across the state are working in collaboration to control this pandemic. To date, a total of 242,480 cases have been reported to public health. The recent increase in cases has resulted in an increase in the COVID-19 rates in many counties, and last week the percent positivity increased to 6.3%. I want you to know that at the Arizona Department of Health Services, we remain on high alert. We've worked to contain COVID-19 from all angles, and we continue to take further action in light of recent increases. Our actions to date include increasing access to testing, increasing hospital capacity, and ensuring businesses and schools are partnering in mitigating the spread. Over the last few months, we've worked to build up our lab capacity, ensuring every Arizonan has access to COVID-19 testing with quick turnaround times. There were approximately 76,000 to 87,000 diagnostic COVID-19 tests conducted each week over the last 2 weeks. And our major laboratories are currently reporting less than a 24 to 48-hour turnaround time. And there are approximately 500 locations where Arizonans can get tested. And we've enhanced contact tracing at the state and local levels to ensure that once a case is identified, every effort is made to contain it from spreading further. Over the past few weeks, Arizona has seen a gradual increase in the 7-day average of cases and hospital usage. We are working closely with our hospital providers to monitor capacity, and we have invested significantly to ensure all Arizonans have access to care. To date, we've invested almost $150 million for our hospitals and healthcare partners, including $91 million for the purchase of PPE, $34 million to augment Arizona's hospital staffing resources, $10 million to increase hospital bed capacity by supporting alternative post-acute care for COVID-19 patients, and $10 million to the Arizona Coalition for the Healthcare Emergency Response to purchase and distribute 660 ventilators to hospitals. As businesses reopened, we developed requirements to implement mitigation measures, such as reduced capacity and requiring masks. And these requirements are being enforced. As of yesterday, we have received almost 1,900 unique complaints about establishments out of a total of 3,500 complaints. Of those unique complaints, 89% have been addressed and closed, and almost 400 on-site investigations and 1,300 technical assistance and education calls have been completed. We have 7 counties who have agreed to investigate complaints, and we have approximately 32 investigators at EDHS who continue to ensure compliance with the COVID-19 mitigation requirements. We've worked closely with the education community to ensure the safe reopening of our schools, holding weekly meetings with local health officials and the Department of Education. During these conversations, our partners expressed concerns about the instability that would occur if recommendations to move back to virtual learning were based on a change in a single benchmark, especially in smaller rural counties. This variability could cause weekly shifts in educational delivery model recommendations, which would result in uncertainty for families and schools as they plan for the upcoming weeks. To address this, we recommend that all schools meet all benchmarks before moving from in-person, hybrid, or virtual learning. But to be clear, and we're going to clarify the existing guidance later today, we continue to recommend to our schools that they work with their local health departments who have more specific local data to inform their decisions. And so we understand that this has been a difficult year, and many have grown tired of the mitigation strategies. But now is not the time to let up. So please wear a mask when you're in public. Stay physically distanced from people who are not in your household. Consider moving small gatherings outdoors to reduce the transmission. Wash your hands frequently. Avoid large gatherings. Stay home if you're sick. And please get your influenza shot. It's more important than ever this year. All of this will go a long way in keeping our community safe. Thank you, Governor.
Thanks very much, Dr. Christ, and thanks for your good work and the good work of the Department of Health Services. Now I want to talk a little bit about the work of our food banks across the state. As we continue to battle this virus, we know that many people, family, and businesses have been struggling. We know that people need our help, and we want to make sure that no one in Arizona goes hungry due to this crisis. So today, we are pleased to announce an investment of more than $1.625 million to expand access to nutritious food for Arizonans. And here are the details. St. Mary's Food Bank Alliance will receive $600,000 to enhance its delivery model with door-to-door delivery. Community Food Bank will receive $525,000 to reach an additional 2,000 clients. These dollars will help our food banks reach Arizonans across the state from Mojave County to Pima County. Arizona is also doubling up our investment in the Double Up Food Bucks program with an additional $500,000 investment. With this program, for every dollar a SNAP recipient spends on healthy food like fruits and vegetables, they receive an additional dollar to buy more. The Double Up program was championed in our state legislature by Senators Kate Brophy-McGee and Sina Kerr, and it has achieved bipartisan support. And I want to thank both Kate Brophy-McGee and Sina Kerr for their leadership on this issue. I also want to thank every staff member and volunteer at St. Mary's. Every time I come here, I'm so impressed by the commitment and the longevity of the faces and people that are here each time I'm lucky enough to come visit, and to all our food banks across the state. Your work to feed Arizonans during the crisis has been outstanding. So, Tom, can I ask you to come up here and maybe brag a little bit or just share what's happening here at St. Mary's? Please.
Well, thank you, Governor. Here at St. Mary's, we are grateful for the support that the Governor has provided us over the years, and particularly since this pandemic started. You know, when we look back in March and April, which seems like a long time ago, all of a sudden we were faced with double the number of families coming through our food bank. And we also, at the same time, saw people who had never visited a food bank in their life. They were now in need. While that was going on, our volunteers dried up. And because the governor took action and engaged the National Guard, we're able to continue to meet the need within our community, both packing boxes and distributing the food. Today, the Guard is still helping us to this very day. We're delivering to 1,000 households every day. We're putting food in their cars, just at our own locations, not counting the other 400 agencies we have across the state. And last Friday, the Guard helped us to deliver food to 1,000 households in Tuba City in Navajo County on the Navajo Nation. And it's this leadership that allowed us to get this done. And that at the Navajo Nation, it was 4 semi-trucks worth of food that was delivered of fresh produce, meats, groceries, everything that a household would need. So I want to take a moment and thank the governor. Thank you, Governor Ducey, and thank you, Major General McGuire. Today, the governor has announced the funding that will allow us to reach people that are homebound. And these people are in the most dire situation. Many of them have complications that prevent them from going out. And although we have food to provide to them, they can't get there. So this is going to allow us to reach more than 2,000 people in our community, many of them seniors, but homebound, who are in the direst situation. And again, I want to thank you, Governor, for that leadership.
Thank you, Tom.
I want to take a moment and just do a special thank you to all of our donors across Arizona. It was because of your funding and support for us during this critical time that as this pandemic began to grow and the need outpaced normal organizations, we had the resources to get out and help the community. And so we're eternally grateful to our volunteers, our donors that have helped us put us in this type of a position. You have allowed us to say yes to every person who came to St. Mary's Food Bank. And the final thing I'd like to leave you with is this. The governor mentioned it. 53 years ago, this food bank was founded. And for the last 53 years, and hopefully for 53 plus more, we'll continue to be open here for the community. We will be here to help. And the last thing, for those people in need, it's okay to ask for help. Thank you.
Thanks, Tom. And I want to reiterate what Tom said. St. Mary's, of course, not only being the first food bank is something Arizona is very proud of. It's going to remain open, and it is certainly okay to ask for help. There's going to be food here, and the food boxes have never been packed with more nutritious food as well, thanks to some help from the federal government. And something else that Tom said is that what's happened here wouldn't have been possible, of course, with the consistent volunteers that he has, but also with the help of the National Guard. And the women and men of the National Guard have been invaluable. They're invaluable every year. They've been even more invaluable, if that's possible, these last several months, helping out in every way under the sun, from stocking shelves to filling trucks to working on social unrests, and then a variety of ways as well at our food banks. General McGuire is here to give you the latest on those efforts. General McGuire.
Thank you, Governor Ducey. Good afternoon. Thanks, Tom, for having me over, and Dr. Christ. Great to see you again. To all my fellow Arizonans, I just want to talk to you a little bit about what the Guard has done. If you remember, back in the last week of March, we had a press conference here. There was a lot of discussion about how the Guard would integrate. And at that time, Governor Ducey had authorized activation of the National Guard under the Emergency Support Function 11, which is about food and natural resources and food chain security. And in the military, we have a motto, first in, last out. And the first mission that we were into was this mission, and this will be the last mission we're out of. Many of my colleagues in the media have heard me discuss that when we formed this task force, at the height of the task force, we had 1,080 of your neighbors serving in all counties in this state. Right now, we're down to about 750, and the three primary lines of effort that we supported over the last 8 months were in logistics, specifically distribution and food bank and other kind of missions, aviation, and medical. Today, we're down to about 750 guardsmen still on duty. We're supporting food bank missions in 11 of the 15 counties. It's easier to tell you what counties are currently not requesting assistance: Cochise, La Paz, Graham, and Mojave. We've been in all 4 of those counties previously, and at this juncture, we continue to support primarily in the medical and logistics field. Many of you know a lot of our guardsmen were pulled off in an emergency assistance compact request from California, so most of our aviation task force was sent out during the wildfire season. And I just want to say, on behalf of not only the governor, but as the commanding general and all the Arizona citizens, I could not be prouder of how these 1,000-plus soldiers and airmen have carried themselves, have executed this mission, and for order of magnitude, over 110,000 boxes and families fed just out of this one facility. 46 facilities supported today, rough order of magnitude, somewhere between 2.5 and 3.5 million meals distributed by our National Guardsmen in all 15 counties. And I just think it's a testament to that motto of always ready, always there. And I could not be prouder of their service and the things that they've done. And we will continue to do that under the governor's direction based on requirements going forward. So thank you very much, sir.
Thank you, General, and all Arizonans share in that pride. I know it's customary for many citizens. I see it often when they see a woman or man in uniform to say, thank you for your service, and I extend that gratitude on behalf of all of our citizens. I want to say thank you once again for all the good work that's happening here at St. Mary's to feed Arizonans in need. As we press on in the fight against COVID-19, we're going to continue to invest in big ways to help Arizonans who need it most. I'm confident if we continue working together, we will protect lives, we will save lives, and we are going to emerge stronger as a state. And with that, we'll open it up for some questions. Patrick?
Let's start over here with Howie. Hi, Governor.
Hi, Howie.
Your health director keeps talking about small groups, setting examples. I watched you and the president at a couple of rallies this week. I understand constitutionally First Amendment, but what the hell kind of example is that setting when you've got thousands of people like that in Arizona, super spreader events as Dr. Fauci would call them? Aren't you a little ashamed to be setting that example?
First, I want to say we've been consistent the entire time through the pandemic to protect people's rights under the Constitution. I don't remember you asking me any question like this as peaceful protests were happening undeterred inside our state. And there's 5 days left in the election cycle, and we'll continue to protect people's rights. Yes, it does. People have rights under the Constitution. They'll be protected in Arizona. That's the answer.
Even if it's spreading the virus, the very virus that Dr. Chris said, don't gather in large.
We've been consistent. We've been consistent throughout the pandemic. We were outside, and I saw a lot of people wearing masks as well.
Claudia from ABC Next.
Yes, this is Dr. Chris. There's been a lot of secrecy about what's happening at Haven of Lakeside, the long-term care facility. We now know there's been a deadly outbreak of COVID-19, 41 confirmed positive cases in a 1-week time period. Are you prepared to take any action against them?
So we work with all long-term care facilities on reports of potential outbreaks. So our licensing department partners with public health. So we are aware as cases are being identified. We will dispatch a licensing team up to go do investigations and to do technical assistance with those facilities. If they still need help and additional assistance, we will send our licensing surveyors back up. But we also work with our local county health departments, who are the boots on the ground, who can provide infection control processes as well. So we work very closely with all of our long-term care facilities, especially when there are potential reports of outbreaks.
Well, these are confirmed reports that we were able to confirm because we had to do our digging with the federal government.
So if there have been reports of confirmed cases in a long-term care facility, our licensing surveyors have been out on behalf of CMS.
Governor, this question is for you. You said in your closing remarks that the state of Arizona is going to invest big to help Arizonans. Will that ever include an increase in the low $240 a month unemployment benefits that Arizona provides to citizens?
So what we're focused on right now, Ben, of course, is protecting the most vulnerable through the pandemic. The state has been able to serve more than 1.1 million Arizonans in need. This rose from an unemployment list of 17,000 in February. Over $11 billion has been distributed to keep people from falling through the social safety net and to stretch and strengthen that social safety net. Today, and I think everyone here will recall, we did anticipate a rise in cases. We did say we're going to stay vigilant and we're not going to let our guard down. And we're addressing in July and August the need for flu shots in the fall. And while we're seeing a rise in COVID-19 in other parts of the country, the spike has not yet come to Arizona, but we are anticipating it. So we're going to continue to do that, work with the federal government if there are additional dollars to come from that standpoint. But what we would encourage people in this economy that we have in Arizona right now is there are jobs available. So people that were working in February and March before the pandemic were, I think, at 96.9% of our job rate. So we're coming back strongly. We have state benefits. We have state benefits that will remain in place. And if the federal government is going to step up, if Congress ever wanted to do its job through the last 6 weeks, we'd be here to work with them. Hi, Allie.
Why the change in the school benchmarks? KTAR talked to Superintendent Kathy Hoffman recently, and on a scale of 1 to 10 and concerned, she's at a 7. What are you doing? Are you concerned about the outbreak in cases for kids at schools, and what's being done to mitigate that?
Well, first I want to say I've been concerned the entire time. This is something we've taken seriously since the first case in January when we set up the Emergency Operations Center. We had a declaration of a public health emergency in March, and we've ramped up, as we've known more, things that we can, not only to protect the most vulnerable, but try to allow us to live in the safest way possible. And part of that is getting our kids, where we can, back inside a classroom. So anything that's been done inside our schools has been done in coordination and cooperation with public education leaders and public health officials. And what you're referring to was actually done at their request.
So if all 3 levels now have to be in the red, do you think you're sending a mixed messages from months ago? And are people, if their message is now to indicate some kind of spread for kids that are at the highest risk, how does that kind of change?
Send any mixed messages. We did want to have alignment with the guidance that we have out there for the entire state. And these adjustments are just that. They are guidance. Regardless of what we have out there, we're going to have teachers with underlying health conditions, and we want them protected and be able to teach virtually. We've got some parents that, for whatever reasons, personal or otherwise, do not want their child inside a classroom today. That child can learn online, but where it is possible and safe, we want our schools open, and we want our kids inside a classroom with a teacher at the front of the classroom and them getting the best, safest education possible.
Michael, how was the decision made? Because we've heard from other districts like Mountain Hills saying that they didn't know anything about this change. So who actually was consulted when it came to actually changing these guidelines?
This was done, like I said, with education leaders, the superintendent of public instruction, and public health officials.
But Governor Chris said earlier at the very end, I believe, it's not the time to relax kind of our guidelines when it comes to schools or allowing more people into, say, Crawford Stadium or just the rallies that we've seen non-socially distanced. How do we square that if it's not time to relax, so we're making guidelines easier to deal with and seeing more people out?
the attempt is to clarify and to bring as much clarity to a very difficult situation as possible.
Maria next. The public, please.
Hi, Governor. The School Facilities Board, which is legally required to inspect schools, paused those inspections in March and has not resumed them. More specifically, has it taken any action to inspect school ventilation systems ahead of students returning for in-person learning, as some other states have? Why not? And can Arizonans expect those inspections to resume?
Can you repeat? I'm having a tough time hearing you.
Sorry, for School Facilities Board inspections,
Mm-hmm.
they paused those throughout the pandemic and are not inspecting school ventilation systems. There are some concerns that those aren't happening as students are returning to in-person learning. Are those going to resume soon?
Well, I want to dig in to the question so I can get the facts and understand why something would have paused during the pandemic. Of course, our top priority is the safety of our citizens, and our kids inside schools are even above that. So I've got to follow back with you, okay, Maria?
Dennis, go ahead.
And a question for Dr. Chris. You want to get a medical opinion, how he was asking about these rallies. Your medical opinion. Did these rallies with these thousands of people with no masks, close together, outside, put the public health at risk? Did this risk spreading this virus? Do you recommend people attending these rallies go and get tested?
So we would recommend any time people attend a large gathering, if you think you've been exposed to or infected with COVID-19, to go get tested. And we do offer that free testing through ASU. Because it's outdoors, that does lessen the risk. But what I would recommend to Arizonans is that they are going to attend a large gathering or even go somewhere that has people that they don't live in their household with, make sure that you are taking those precautions and stay 6 feet away from others.
But is this a super spreader event? Do you think this puts the public health at risk?
I think any large group is a potential risk for spreading. I don't have actual data that shows that cases are linked to those.
Do you recommend outside of politics? Would you recommend that these type of events, would you endorse them or not?
I would say it would depend on people's risk and what risk level they're willing to take.
So there are situations where you would say it's okay to gather in large groups like this without masks?
I would always recommend to wear masks.
Dr. Chris.
Sorry.
So just adding on to Dennis' question, there's been other states like Minnesota that have been directly linked to an increase in COVID cases because of these rallies that the president has held. The president was just here yesterday with 2 large rallies with thousands of people standing shoulder to shoulder, not everybody wearing masks. The president was here a week ago. Same situation. Does that concern you that we're already seeing cases increase, that we could see them increase even more because of these rallies?
I would say that we would encourage people to, if they've been in a large group, such as a rally or other large gatherings, that they make sure that they're monitoring for symptoms. Anytime you come into contact with somebody from a household that doesn't live in your household, you are putting yourself at risk. And one of the things that we're finding is that we're seeing even small gatherings are sufficient for people to be able to spread the disease. You want to make sure you're looking for symptoms and staying home whenever you can. You are safest at home. And our contact tracers will be contacting individuals if they are diagnosed and are confirmed positive with COVID-19 to identify who their potential contacts were.
But are you concerned that numbers could be increasing even more because of these rallies are taking place?
I think that there's a lot of different things that are playing a role into the increase of the cases.
And let me address a little bit, Dylan, if I may, where Arizona is on its COVID-19 numbers in comparison to other states around the country. I think we all know, I think some of our states are heading into what the press is referring to as the third wave. Our first wave, in terms of Arizona, didn't really come to those spikes until the last 2 weeks of June and first 2 weeks of July. We do see this rising in different parts of the country. Our expectation in Arizona has been that cases would continue to go up. But I want you to know today, Arizona is the 13th lowest cases per 100,000 over the last 7 days. We have the 20th lowest positivity rate in the nation today, and we're at 89 cases per 100,000 people in comparison to 133,000 for a national average. So we are not in that zone that we're seeing in other places. And like Dr. Christ said, in terms of addressing the common sense steps to avoid getting the virus or spreading the virus, that will be the priority.
But Governor, you kept talking about those R numbers. Every time they went down, they've been above 1 for so long, which shows it is spreading here, and we are above the national average.
So let me address there's a lot of metrics that one looks at as they make decisions around this. And you're right, the R-naught number is above 1, and I think it's above 1 for 49 out of 50 states. Arizona did one of the best jobs in the nation when our time of challenge did come of driving it beneath 1. But as we head into influenza season, it becomes more challenging. And like I said, we've anticipated that. We've been talking about this for several months. And another number that I think you can look at is COVID-like illness. And Arizona is still in a very good spot from that standpoint. And this is a virus. It's contagious. What we want to do is slow it, contain it to the best of our ability. And when we have a vaccine, we will be able to come as close as we can to stopping it. Although if it's like other viruses, it will likely always be out there. It's just at what level.
Governor, ABC 15 has been trying to get on-camera interviews about the National Guard preparing to deploy troops if there's civil unrest after the election. This will be your call to send armed troops into streets on the West Coast. So what circumstances are you okay with sending armed troops out into the streets?
Well, first I want to say in 5 days, Americans will complete the political cycle and we'll have Election Day on November 3rd. It's our hope and expectation that there will not be civil unrest, that we'll have a peaceful outcome. And while it may take some time to figure out exactly where all the chips fall, that would be the expectation. But can I finish? But the National Guard is always at the ready for potential civil unrest. In the 6 years that I've been governor, it's only happened once, and I think it lasted about a day, and they rose to the occasion, as they always do. But our planning and hope would be that we're not going to have civil unrest. But if we do, the National Guard's at the ready, and we won't hesitate to call them out.
And Governor, why are you not imposing new restrictions before things potentially become worse than this summer? Will you step away from President Trump, who is ignoring the science?
Well, I want to say that the mitigation that we've put out, the plan that we've put into effect and remains in effect. And I am proud that Arizona is open, that our economy is open, that our educational institutions are open, and our tourist destinations are open. While at the same time, we do have mitigation steps in place that have allowed us to protect lives while protecting livelihoods, and we're going to continue to do that. We make the decisions for Arizona, okay? It's different here in our state than it is in other states. We've pointed out, and sometimes the national news, I think, can conflate everything together. Arizona's in a position right now where we need to be vigilant and keep our guard up, but the rise in cases, the concern at the hospital level is not happening in the state of Arizona at this time.
What are the parameters then for shutting down bars, schools, and businesses? Are you following parameters?
Yes, we've put a plan out there, and the plan remains in place.
Governor, I got one for Dr. Chris and then one for you, and then you can go ahead first.
No, he can't.
So, Dr. Chris, we've gone from 500 cases a day to 700 to more than 1,000 over the last 3 or 4 weeks. We're going into winter. The flu season's going to be here. Hospital capacity is there, but if we get snowbirds coming in and we see the growth that you expect, what's your time frame for when you think we
So as we look at the next few months, one of the biggest worries that we have is people getting together for the holidays. And so what we've identified is that people don't estimate the risk when they're with loved ones or family members in small household gatherings. We do know that we see a lot of the largest number of cases are in our 20 to 44-year-olds, mostly in our college-age students. They're going to be coming home and may not be going back to school during Thanksgiving and then having holiday celebrations. I hope that I am wrong, but what I would anticipate is to see a spike about 10 to 14 days after Thanksgiving, and then potentially continue to increase over the next 4 to 6 weeks. So we are going to be putting out guidance about, just like we did for Halloween, how to celebrate a safe Thanksgiving and safe alternatives. We will also be working on mitigation strategies, but we are working with our hospitals as well to ensure that they have what they need. I think the biggest barrier is not the beds, but could be the staffing.
I want to follow on and then answer your question. As you pointed out, we are seeing a rise in cases. We are increasing our testing in the state of Arizona, and we have a rise in positivity. So one of the things that I think in Dr. Christ's comments, she mentioned about 3,000 testing sites in the state of Arizona. So if you are having a child come home or a kid come home from college, this idea of getting tested is a very good one. So please take advantage of the testing. And the turnaround time in Arizona today is not what you're reading in some other places around the country that for whatever reason it still takes 4 or 5 days. You'll get it same day or at the most next day or the day after, and that's been very good. So I want people to please take advantage of that.
So I wanted to follow up on a topic that was brought up earlier, which was the unannounced change in metrics for schools. The 1.1 million Arizona students, they all have parents, they all have families who have looked to your administration for guidance on this and trusted you. And then to quietly unannounce with the large press.
Bob, that's just not true. That's just not true.
It was not put out and it was changed, but no one, it was the media.
It was done in court.
The media noticed it, and that's the only way that the people learned about it. Is that the type of transparency that you believe is important?
We're going to be fully transparent during the entire pandemic. And you're mischaracterizing this, Bob. These are guidelines, and there's always been flexibility for our parents, for our students, and for our teachers. And these guidelines were adjusted at the request of public education leaders in coordination with public health officials. And that's how we'll continue to do that. And we will be completely transparent. I think the way you're characterizing it is to try to position it that way. It was done, okay, I did answer the question. It was done at the request of public education leaders and in coordination with public health officials. These have always been guidelines along the way, and I think if you want to see the different ways that they're being implemented with local leaders and parents making the decisions that are best in the situation for the county or the neighborhood or their own family situation, you can look to Arizona as a model example. It was done in, I've answered the question now several times. You may not like the answer, but that's the fact. That's the fact. So I'm going to close.
Arizona School Boards Association says they were not informed. They represent every school board in the state. They were not informed, and their executives say this was done to put pressure on them.
There's no, the pressure should be to do the right thing. The pressure should be to follow public health and to protect our kids and our teachers and make sure that our students get the best possible education. This is something that was done, and I hate to have repeater's disease, but you guys keep framing this in a different way. It was done with public education officials and with public health officials, and it is transparent and it's on the website. I want to close by saying thank you to Arizonans for weathering the storm to date. We know that there is a storm ahead of us, yet it's not here. But those simple guidelines of wearing a mask, washing our hands, being socially distanced, and using common sense have served us very well to date. I'd ask that you continue to do that. And again, I'm just going to listen to the doctors and the officials as to what we're doing in Arizona. But if you look back, and if past is any education for what's in front of us, our easiest time, if there's been an easy time, was really in the March, April, May time frame when our weather was so beautiful and we could spend so much time outside. Now, Dr. Chris says we're safer at home, and she's right. But if we're not at home, if you can be outside in any gathering and taking advantage of the much milder climate, you're safer there. That may help us to slow the spread. Of course, as she said, please, if you can, get your flu shot and use the common sense you've been using so well so far. Thanks, everybody, and we'll see you very soon.
All right, you have just been listening to Governor Ducey address COVID-19 issues. It's been a while, about a month, since he has last held a press conference. This time he's doing it at St. Mary's Food Bank. The reason? Because so many more families are needing help, especially families who never even needed help. They've seen double the amount of families who need help. So in light of that, Governor Ducey, the big announcement that he made this afternoon is that there will be funding, $1.625 million in funding to expand access of food. That will go towards enhanced delivery models, also reach an additional 2,000 clients from Mojave to Pima County, and they will also double up on the food box program, which basically allows families to get twice as much help for every dollar spent. On the Department of Health front, you just heard from Dr. Kara Christ, the director there. There are trends that are happening nationally and both locally here, and those COVID-19 numbers are moving in the wrong direction. We've told you many times in the news that the numbers are ticking up. In fact, here in the state, they've seen 242,480 cases reported. There's a 6.3% positivity rate. So in light of those numbers ticking upwards, here's what the state is doing. They are increasing testing. They're increasing hospital capacity and lab capacity to make those results turn around even faster. They've also increased locations to get people tested. The state has also purchased $150 million that will go towards more PPE, hospital resources, and ventilators. They also have 32 investigators at DHS to look into the cases of noncompliance. And as far as schools go, they still recommend local schools check in with their local districts as far as benchmarks and what to follow there. The biggest concern, though, for the Department of Health Services, Dr. Chris says, is that families gathering over the holidays. Obviously, we are approaching holiday season right now. Specifically, her concern is 20 to 44-year-olds because they will be returning back to home for the holidays. So they do expect to see a spike. We're talking perhaps 10 to 14 days after Thanksgiving and then continuing that spike following the weeks ahead. The bottom line they want to stress here, hygiene. So you want to move those gatherings outside, social distance at least 6 feet, wash your hands, mask up, get that flu shot. Of course, we're giving you live pictures right now at St. Mary's Food Bank. You've got the National Guard stepping in. There's been also a great need of volunteers because that has been lacking, obviously, because of the situation that we're facing right now. So again, the National Guard stepping in to help a lot of the food banks. And in this particular case, you're seeing them help at St. Mary's Food Bank. You can get the very latest on 12news.com as well as on all of our social media channels as well. Of course, here at 12 News, we are on top of this and we'll give you the very latest. I'll see you back here for First at 4. For now, let's get you back to Daily Blast Live.